People say that hypertension is a silent killer disease. What about stroke? I mean, stroke is also deadly because sometimes you might not know or you might not see the symptoms, or it can just happen anyway. You can just be walking and you just slump. You get? So I think the both of them are silent killer diseases. So let's talk about stroke in this video. So guys, today we are going to be talking about stroke, and I have a little book where I had written some points down that will help me discuss this topic with you very well. Stroke is the common name. However, in our world, like in the medical world, we call it cerebral vascular accident. Now, I did not say cardiovascular, I said cerebral. Cardio has to do with the heart, and cerebral has to do with the nervous system, the brain. Hence, the name is cerebral vascular accident. But for this video, we're going to be using the common name stroke so that everybody can flow with me. Stroke is an acute compromise of the cerebral perfusion or vasculation. In other words, I mean when there is a compromise of the cerebral vascular system, that is the vascular system supplying the vein. When there's any compromise there, it can lead to stroke. I also want you to know that stroke is a leading adult disability worldwide, and there are causes of stroke, with hypertension being the leading cause. Now you see why I said that the both of them should be two together. There should be the two silent killer disease. Now, in younger population, there are other causes of stroke in younger population. Number one is illicit drug abuse. Two, we have clotting disorders. And three, carotid dissection. These are causes of stroke in younger population. Now, I want you to know that there are three types of stroke. We have the ischemic stroke, we have the hemorrhagic stroke, and we have the transient ischemic attack, TIA. The ischemic stroke. What is this ischemic stroke? Ischemic stroke occurs when a vessel supplying the brain is obstructed. Okay, this reduces blood flow. What am I trying to say here? Let me give you an illustration. Now, supposing there is a pipe. Okay, let's use your toilet system as the example. Now, imagine that normally everything in your toilet bowl should go into the drainage system, right? Now, anything that blocks the blocks everything that should go into the drainage system causes what? The inability of the toilet to flush. I don't know if you get what I'm trying to say. Now, when you defecate, when you urinate, you have to flush the toilet and everything moves into the what? Drainage, the soakaway pit. However, there are cases whereby something is blocking the toilet. Okay, you find out that when you flush it, instead of it to flush the feces into the drainage system, you notice that it doesn't what? Flush out. Rather, the water is increasing, like it's not moving inside the drainage system. That is a simple example of what ischemic stroke is. There is something blocking the vessel that is meant to supply oxygenated blood to the brain. However, that vessel is what? Blocked. So you find out that the brain cells are lacking blood that contains of oxygen. What happens is that the brain cells begin to what? Die. This leads to what? Ischemic stroke. Now, this could be as a result of fatty deposits buildup. For people that have a lot of fat, maybe the fat in any part of your body starts circulating, moving around and around and around and around, and gets to the vessel supplying the brain and builds up there and blocks that what vessel. It leads to what? Ischemic stroke. Or blood clots. Maybe there's a blood clot in one part of your body and it doesn't completely destroys or dissolves. It starts moving, strolling, flowing, and all of a sudden finds its way to the vessel supplying the brain. It will what? Cause ischemic stroke. Second one, which is hemorrhagic stroke. What is this hemorrhagic stroke? This occurs whereby the vessel supplying the brain ruptures or leaks. For example, maybe your pipe, these the pipe in the sink, in the kitchen sink. Let's say there's a leak in that pipe. What will you experience? You find out that when you finish washing your plate, instead of it to just flow out, notice that it starts pouring on the ground of your kitchen floor. Okay, because the pipe is leaking or it's ruptured. Maybe someone pierced it or there's a hole somewhere, causes that the water that you use in washing plates will just be pouring on the floor. What some people do is that they put the bucket under the kitchen pipes, sink pipe, right? So in hemorrhagic stroke, the vessel supplying blood is leaking or it's ruptured. Maybe something caused it to rupture. What will happen is that blood starts flowing into the external environment of the brain, which is not a good condition. This is what we know as hemorrhagic stroke. Now, there are factors, just like in ischemic. I said that fatty deposit buildup can cause this ischemic stroke. Now, there are factors that can cause this hemorrhagic stroke. I have like 6 factors here. Number 1 is high blood pressure. Now you see why I say stroke and hypertension should be going hand in hand as the silent killer diseases, especially when the high blood pressure is not controlled. Number 2 is over treatment with blood thinners. Maybe it says that you have a disease condition that you need to treat with anticoagulants and you overtreat yourself with that anticoagulant. It can cause this hemorrhagic stroke. Now, number 3 is aneurysms. Number 4 is head traumas. Now, you've had situations whereby someone had an accident. Okay, let me even give an example. There's a certain time I had this accident, just a very minor accident. I remember then I was little. I remember one of the things they were checking out for is to ensure that I wasn't bleeding internally in my head, because I fell with my head. So people that have accident whereby maybe they hit their head so hard or something like that, you've had cases whereby the person is actually not having any issue, like there's nothing wrong, there's no bleeding, nothing. All of a sudden, person just slumps and they find that the person was bleeding internally in the brain or in the head. This is one of the factors that can cause the person was experiencing hemorrhagic stroke. Now, the 5th one is protein deposits in the blood vessel walls that leads to weakness in the vessel walls. The term is a cerebral amyloid angiopathy. That means there are protein deposits in your blood vessel, in the vessels. Now, those protein deposits makes the blood vessels to be weak. Okay, and when they become weak, when something is weak, what's happening? It can easily break, it can easily rupture, right? So that's what happens in this cerebral amyloid angiopathy. Then the last one is ischemic stroke that leads to brain hemorrhage. Like the person has ischemic stroke, then it now moves into what? Hemorrhage of the brain. So these are the factors that can lead to hemorrhagic stroke. Now, transient ischemic attack, TIA. Now, from the name transient, it means what? It simply means temporal. That means it's not a permanent damage. It's something that temporarily occurred. Maybe it's a temporarily, slump. It does not cause a permanent damage. Do you understand? Yes. This is and I say there, it occurs when there's a temporal decrease in blood supply to the brain. Maybe the blood at the point there's just your body just decided to malfunction and does not supply blood to the brain. Just like I said, temporal. So the person might just slump, person might just experience some partial paralysis and come back to normal. We call it mini strokes. Okay. Yes. So these are the 3 types of stroke. Now, I want you to know that 85% of stroke that people experience is ischemic stroke. The rest is between transient and hemorrhagic. Now, what is the risk factors of developing stroke? What do I mean? What are the things that predisposes you to developing a stroke? Now, I'm going to divide it into group: lifestyle factors and medical factors and others. Now, under lifestyle factors, we have being overweight or obese. Number 2 is use of illegal drugs. Now, for people that you love illegal drugs, what are the illegal drugs? Like cocaine, right? All these illegal drugs. This can predispose you to having stroke. Number 3 is heavy or binge drinking. I always say this thing: I don't know what you people see in taking alcohol. Like, I have not seen the benefit. The 4th one is lack of exercise. All of those that fall into my category of we will exercise this year. I know we've not started exercising, but please try. Even if it's walking long distance, maybe you trek a certain amount. You understand? Especially if you have a sedentary lifestyle from your house to your office and you sit down all through. Please try and include some exercise in your routine. Now, these are all for lifestyle factors that predisposes a person to developing stroke. Now, the second group is the medical factors. This includes cardiovascular diseases. All cardiovascular diseases has a risk of predisposing you to developing stroke. Number 2 is hypertension. I've been singing it right from the beginning of this video. Hypertension, hemorrhagic hypertension, leading cause of what? Stroke. So, especially when you do not control this hypertension. Then we have cigarette smoking or second-hand smoking. Now, the last one is speech. Does the person have a slurred or a strange speech? If the person has a slurred or strange speech, it's also a sign. Then the last one, which is T for time. Immediately, all this from the face, the arms, the speech, everything, you've identified those 3 things. The last thing to do is to call the medical professionals immediately or take the person to the hospital. This will help to prevent any casualties. So we're going to talk about the preventive measures. Now, the preventive measures is taken from the risk factors. Okay, if you know what the risk factors are, you'll be able to prevent it. Like I said, lifestyle factors: do not be obese, ensure you maintain a healthy weight. Lack of exercise: start exercising or include exercise in your routine. Use of illicit drug: stop using illicit drugs, stop abusing drugs. Drinking, heavy drinking or binge drinking, whatever. Either you minimize the way you drink, which still I don't advise you to drink, but either you minimize it or you don't even drink at all. Then cardiovascular diseases, all the things that can cause you to have that can cause you to, or that can predispose you to cardiovascular disease, you try to prevent it. The ones that you can prevent, you go to the hospital and get treated. Diabetes, reduce your intake of sugar, ensure you maintain a healthy sugar level. High blood pressure, if you are predisposed to high blood pressure, ensure you get treated and try to manage it. Then cigarette smoking or secondhand smoking, very simple. Do not smoke and don't stay around people that smoke. Then high cholesterol, ensure that you eat food that are in a good amount, in a good or healthy amount of cholesterol. Avoid food that are heavy on cholesterol. Then we have obstructive sleep apnea. Like I say, get treated for the condition. Then sex hormones like oral contraceptive or hormonal treatment. I mean, it's simple. Stop taking oral contraceptive. It's very simple. Stop taking oral contraceptive, or try and reduce or stop the treatment, stop the hormonal replacement therapy. So this is everything you need to know about stroke. If you have any questions concerning it that you want me to know or to answer for you, please let me know in the comment section and I will get back to you. So in the meantime, if this is your first time coming to my channel, please do not forget to subscribe to my channel, like this video, and comment on this video. Thank you very, very much. See you next time. Love you. Bye. There's nothing beneficial in smoking, and especially if you're saying that, don't say because you're not smoking but you stay around people that smoke. You're causing more harm than good, more than those that are smoking it directly. So do not smoke and avoid staying where people smoke. Then we have high cholesterol. Eating food that are very high in cholesterol. Remember, like I said, ischemic stroke can be as a result of fatty deposits buildup. So when you eat food that is very high in cholesterol, all those fats can be circulating in your blood system. They don't just stay, okay? They circulate. Sometimes it's not in the brain that they go to. Sometimes they go to the liver. The person have fatty liver diseases. Do you understand? That's why it's not good. All these fats, try to burn those fats that you have. Burn it so that it does not cause you problem. Then we have diabetes. Diabetes predisposes you to developing stroke. So do not forget, diabetes comes with a lot of complications. So don't allow what is sweet to kill you. Then history, personal history or family history. Let's say maybe you had your father died of stroke, your grandfather died of stroke. Just know that there's a possibility, it's hereditary. So you try to avoid anything that can lead to those stroke. Then another one is COVID-19 infection. Yes, COVID-19 infection can also cause or predispose an individual to having stroke or developing stroke. Then the last one is obstructive sleep apnea. I don't know the pronunciation, but I hope I'm getting it right. OSA, obstructive sleep apnea. This is a medical condition whereby an individual, like while you are sleeping, there will be a temporary stoppage of blood supply to your brain. And the other factors include age, sex. Men are at higher risk of developing this stroke. And finally, hormones. Oral contraceptive or hormonal treatment that contains estrogen predisposes an individual to developing stroke. So these are the risk factors that predisposes an individual to developing stroke. Now let's talk about diagnosis, laboratory tests to diagnose stroke. Now, these tests, number one, include full blood counts to help check the level of platelets. Platelets are cells that help towards clots. They play a role in coagulation. So we have clotting tests. There are two clotting tests that can be done. We have prothrombin time and what's this other name? Partial thromboplastin test. Now these two tests are done to measure how quickly your body clots, like your blood gets clotted. Does it clot fast, or does it take time to clot? You do these two tests. Then the third test is serum electrolytes. Now serum electrolytes, when a person has issues with the electrolytes, it can present with symptoms of stroke. So when you do this serum electrolyte, this is to rule out issues and know if it's as a result of if the symptoms are as a result of kidney problems. Do you understand? So to help you rule out that it's not anything that has to do with the brain. Then the next test you can do is thyroid test. Yes, thyroid test is done to measure the thyroid hormone. Now, an individual that has hyperthyroidism is at a risk of having arterial fibrillation, which can lead to what? Stroke. Now, this arterial fibrillation is known as irregular rhythm of the heart. Okay, the next one is C-reactive protein or blood protein test. When your body is inflamed or when you have inflammation, your body tends to release substances into your bloodstream. Okay, now arterial injury or poisoning, anything that affects the arteries, is a sign, is a cause for what? Inflammation. So as a result of that inflammation, these substances are released into your bloodstream. So tests for this can help towards diagnose what? Stroke. So other tests you can do are imaging tests, which include computed tomography, CT, ultrasound, magnetic resonance imaging, MRI, echocardiogram. These tests are the radiography set aspects that you can do to help diagnose stroke. So we're going to talk about the preventive measures. Now, the preventive measures is taken from the risk factors. Okay, if you know what the risk factors are, you'll be able to prevent it. So this is everything you need to know about stroke. If you have any questions concerning it that you want me to know or to answer for you, please let me know in the comment section and I'll get back to you. So in the meantime, if this is your first time coming to my channel, please do not forget to subscribe to my channel, like this video, and comment on this video. Thank you very much. See you next time. Love you. Bye.